I'm Dr. Daniel Jones, and this video is to help you prepare for your upcoming hip surgery. I appreciate you taking the time to watch this video prior to your preoperative appointment. It's designed to help you maximize your recovery. First and foremost, no eating or drinking after midnight the night before your surgery. This can lead to cancellation or delay of your procedure. Appropriate preoperative preparation can decrease your risk of infection. Fortunately, infection risks are less than 0.5%. Using Hibiclens cleanser can decrease that infection risk. We prefer that you use it at least one night prior in the morning of your surgery, though high-risk patients would benefit from 4 nights prior and the morning of. There will be specific instructions on how to use it in your preoperative packet. Additionally, washing your sheets and using clean pajamas in the weeks leading to surgery can lower bacterial burden. Prior to your surgery, you'll need to obtain a few items from a medical supply store. The first item is a front-wheeled walker. This is essential for safe ambulation after the procedure and can lower your risk of a fall, which can lead to a fracture or dislocation. Secondly, you'll need a leg lifter, which will help you get in and out of a bed or in and out of a car. Third is a riser for your toilet seat. This will help you get on and off the toilet. Finally, compression squeezers that go on your calf. These can lower your risk of a blood clot, which runs at about 3% postoperatively. These are optional because we also provide you with compression stockings from the surgery center or the hospital. You can use one or the other for 2 weeks postoperatively. Next, we'll talk about postoperative medications. We use multimodal pain control to minimize the amount of narcotics that are required. On average, my patients use 2 to 3 days of narcotic pain medication. The recovery is like a bell curve, and some people use more. We provide a maximum of 6 weeks postoperative narcotic medications. I usually prescribe oxycodone or Norco, also known as hydrocodone, postoperatively. Additionally, we recommend taking Tylenol if your prescription does not include it, at a dose of 1,000 milligrams 3 times a day. In addition to the narcotic and Tylenol, we prescribe meloxicam, which is an anti-inflammatory, so you cannot combine that with other NSAIDs like ibuprofen, Aleve, or naproxen. Omeprazole or Prilosec is often prescribed in addition to the meloxicam to help protect your stomach. You will receive postoperative antibiotics either through your IV if you're at the hospital overnight, or a 1-week prescription if you go home the day of your surgery. I recommend my patients take 6 weeks of postoperative blood thinners to lower the risk of a blood clot. We prescribe low-risk patients aspirin, 81 milligrams twice a day, and higher-risk patients will receive a little stronger blood thinner like Eliquis or Xarelto for 6 weeks postoperatively. Occasionally, we'll stop that at a month and transition to aspirin. My team usually prescribes Zofran, an anti-nausea medication, because that is a common side effect of the narcotics. We also prescribe stool softeners to lower your risk of severe constipation postoperatively, which can be a serious problem leading to an emergency room visit. Please take a detailed look at your preoperative packet on constipation prevention. We prescribe Colace, Miralax, and there's additional medications that may be required if you're not having a bowel movement within 2 days. Surgery stresses the body, and a good diet and nutrition supplementation can improve your recovery and decrease the risk of a wound problem. We recommend protein supplementation, vitamin D, vitamin C, and we also provide at times nutrition counseling and nutritional support through our office. If you're interested in one of the latter items, please let us know. After surgery, please keep your dressing on until your 2-week postoperative visit. It's waterproof, so you're allowed to shower directly over top of it. If it does get saturated, please let my office know immediately. Walking 5 to 10 minutes every hour can lower your risk of a blood clot after surgery. We don't do formal physical therapy frequently after hip replacement surgery, but if you're interested, please let us know. We often make that assessment at the 6-week mark. There are some very basic exercises that are in your preoperative packet that can help you get stronger. Bruising is expected after surgery and commonly tracks down to the buttock, knee, or even your foot. If you notice a high amount of focal swelling at your wound, please let us know. Swelling can be managed with using the hip wrap that we get you at the hospital or the surgery center for 3 days, compression stockings, elevating your leg above the level of your heart, as well as using ice packets, or my personal favorite, bags of frozen peas from Costco, cycling on and off every 20 minutes. Dental work is important to avoid for 3 months after surgery. There are more specifics on dental precautions in your preoperative packet. Please read through your preoperative packet. It includes information that was not discussed here. We take your recovery seriously and want you to have the best possible outcome. If you have any questions, please reach out at any time to my office. Thank you for trusting me with your care.